Hi, I'm Deb Flashenberg. I'm the founder and director of the Prenatal Yoga Center, and thank you for watching our video, What is in my Doula Bag? So what you're watching was originally taped for Periscope, which is an online streaming service, and viewers can come on and ask questions and view it. So sometimes I stop and I answer a question. Also, because it's live, sometimes the camera in the beginning as we get it set up is just a little bit shaky and wonky until we get ourselves going. So I hope you enjoy our video, What is my Doula Bag? And have a wonderful birth. Take care. What I talk about a little bit today was my doula bag. So let's talk a little bit about why I'm doing that. So on Monday I did a Periscope about what a doula is and what they bring to the table, as well as the reason for having a doula. So just to back up, what is a doula? A doula, well, I'm talking specifically for a labor support doula. A doula is someone that is hired independently by the couple, and some hospitals do offer them, but here in New York it's by the couple, and the doula is there prior to the birth, where she's going to meet the couple and have a prenatal meeting and find out a sense of what they want in their birth. And then she's an advocate, and she's going to be on call from 37 weeks on until the woman gives birth. So she's offering physical, emotional, and informational support. So with that, I got a lot of people saying, okay, so what exactly is in my big doula bag? I was talking about that. So my doula bag, it's literally a big green backpack, and I'm a little OCD, so I kept kind of running notes about what I always try to have in there, so after birth I can replenish. So I thought today I would go through my doula bag, and in some of this I have some of my non-pharmaceutical pain relief methods, and then some I just have some great tips for the partners to have and for the women to think about what to bring with them. So we're going to start, and again, if you have any questions you can always jump in and ask, and I'll do my best to answer those. All right, so I'm a little old school. I actually have a watch because I find it easier just to kind of glance at my wrist as opposed to pull my phone out, type my password in, and then check things out. Plus, I don't want to have to deal with the second hand on my iPhone. So I like to check out the basic timing of the contractions. So I'm not one that's going to write pages and pages and pages of notes on the contractions. Just to get a sense of how far along things are, I'm going to glance down and see what things are, how things are going. I also like to have my watch because I do keep pretty strict notes on how, if any interventions are happening, like if they're deciding when the water broke, or when the water was broken, or if PIT was introduced, or even when we got to the hospital. I just like to have a sense of where things are. So if we look back, we could say, oh, you know, we got to the birth center at this time. We were admitted, water broke, or Pitocin was introduced, or got an exam, and this was the time it was, and this is what it turned out to be. So I like to be, I'm a little bit of a note taker, which brings me to, I have a pad and pen. Again, I could be typing this into my phone, but I find it just so much easier just to have my pad of paper, write things down, have my watch. All right, so also in my front small pocket of my doula bag, it's a little silly, I have toothpicks. And the reason for this is I often like to have food for the mother. I usually fruit because it's very digestible, but I also have some for the nursing staff because I think it's always good to have some allies. And so I have little toothpicks in my fruit tray, and I'm offering them some snacks as well as helping the mom have some nutrients during birth. I'm going to be outright and say I don't believe in starving the mother during birth. I think we need to have some nutrients. All right, in that front packet, also, I've got some large Ziploc bags. So here in New York, sometimes it's a little bumpy on the cab ride in, and during transition, vomiting has been known to happen. So I like to have a bag ready. So should the mom be saying, I think we're going to throw up, I want that bag ready. And then I can seal it right up. Fortunately, I've actually never had to use it, but I like to have it ready. So partners at home, keep in mind that on the way into the hospital, depending on where the woman is in her labor, you might want to have a bag in case she throws up. I also like to have cornstarch. Now that sounds a little bit strange, but massage is really a wonderful technique of pain management. And sometimes oil feels just a little too slick, or if the mom doesn't like the smell of any specific oil, even if it's pretty harmless in the smell, and baby powder is not a good thing. So I like to use cornstarch because it's a great way to give the mom some back support and rub without getting that oily, lotiony feeling. So cornstarch. All right, and then I was talking about the idea of eating. So I have some really high quality candies or even honey sticks, or there's these wonderful honey candies that if you suck enough on them, there's honey in the middle. So the reason that I like to do that one is because if the mom's blood sugar is dropping or she's being really, the care provider is being very strict about not eating, I want her to be able to get some sugar in her body. So if her blood sugar is dropping, we can try to remedy that. All right, so that's the front pocket. And before and after birth, I always make sure I have everything there. All right, so my middle pocket, now this might sound a little strange, but bendy straws, you know, the kind that actually bend to the top. So if I'm giving the mom some water, she doesn't have to kind of maneuver around the straw. She can have that little bendy straw right to her mouth. I also, let's turn the page, this is me being a little OCD, I'm gonna own that. I take hydrogen peroxide because I know the hospitals are supposed to be clean, but I've seen some dried blood on the floor, and so I'm not too keen on that. So when I get in there, I like to clean off the sink area, the toilet, and if there's a bath or shower, just do a quick clean. Again, knowing that the mom might be using that as well as myself and the partner. So there we are, a little hydrogen peroxide, a little clean. I know, OCD. I also carry Band-Aids and Neosporin because if anyone cuts themselves, I want to have something to take care of that because I don't think hospitals are the cleanest situation. Now, this one also might sound a little strange. So I used to bring my yoga mats. I'm a yoga teacher, but I found it sometimes hard to keep folding. And so people that garden might find that there's these pads that their knees can go on, these little gardener pads. And so that fits in my backpack a lot easier than my yoga mat. So if the mom is on her hands and knees, or if I find that she's not using it, I'm on my hands and knees, if I'm like pressing on her back or massaging, it's really helpful for the knees. So otherwise I find the knees for myself and the partner and the woman get really sore. So I want to give her that. Along that line, I think my best and favorite pain management is called a hot water bottle. Totally old-fashioned, like it's a little screw on top. It's about this big and it's rubber and you can just fill it from the sink. So I'm not worried about like an electronic or electrical heating pad. I'm not trying to heat something up in the microwave. Straight up hot water bottle. And I apply that to the mom's lower back quite a bit and sometimes even to her lower belly. And I use it all the time. I also can fill it with ice if the mom's prefers, but most of the time we end up using the hot water bottle. I then have a little toiletry bag just for myself, toothbrush, toothpaste. Partners, you might want to remind yourself that you could be there for a while, especially because for myself, I'm drinking coffee quite a bit and I'm breathing with mom and I don't want my coffee breath in her face. So toothbrush, toothpaste. I mentioned the cornstarch earlier. So if the mom prefers massage oil or aromatherapy, I make sure I have several different types with me. And usually I've talked to her about ahead of time, are there any smells that she has an aversion to, or are there any smells she really likes? So I'm going to have that on hand. And then lastly, I like to have a hairband for myself and the mom. And now I'm going to move to more my middle pocket, my other pocket, and I'm going in my bigger pocket. I've got another bag of lip balm because the mom's breathing a lot. Deodorant so we can smell fresh, nail file, Advil, cough drops, energy bars, and then, okay, I'm just going to own this. I keep a thermometer on hand. And I know I'm a DONA certified doula, and I know that goes a little beyond that because we're not supposed to be doing anything medical. Now, I have a thermometer on hand. I don't actually take the temperature, but there have been times where the water has broken and the care provider is saying, you can stay home as long as possible, but just make sure you don't have a fever. And I have been the person running out at night, running down the street to Drain Reed, finding a thermometer because maybe the couple doesn't have one in their house. So I have a thermometer on hand. Again, I'm recognizing that's beyond the scope of DONA, but I'm not using it. I'm just offering it to the parents to use should they need to make sure that there's no sign of fever should the water break. All right, and then I also like to have a yoga strap. This way the mom can hold onto it and I can too, and I can help her do some supported squats. Really, really helpful. Sometimes I can even put it around her hips and help her kind of move her body. Along with that, I have what's called a Rebozo. And a Rebozo is this huge piece of fabric. And you can put it around the mom's belly and kind of help shift the hips around. You can help, and that's really wonderful to take some pressure off. That you can do this on all fours. You can have her stand and lift it under her belly, take some of the pressure off. You can get pretty inventive with the Rebozo. That's a wonderful pain management tool. And then the ball, birth ball. So I'm about 5'2", and I recommend up to 5'2", I think it's about 5'8", uses the 65 centimeter ball. So in my bag, I have my ball, and I have a really great pump that can pump that ball up super quick. And so the mom can use the ball in so many ways. She can lean on it, she can bounce on it, she can rock on it. So great to promote optimal fetal position. And I find that not even just during the birth situation, the moms like to use it during pregnancy, but especially after. You know, those babies, they tend to cry in the beginning, and if you're bouncing with the ball with the baby, a lot of the babies settle down. I personally used it with my son quite a bit. My daughter didn't quite take to it. All right, last little bit of what is my doula bag. I have a handheld fan. So if the mom is hot, so especially during transition, it's not unusual for the mom to be sweating a lot during her contraction, but then freezing after, because during the contraction, she's really, really working. And so the body's heating up, and then after she's freezing. So I have a handheld fan. Along with that, I also have the washcloth in case she needs a washcloth on her neck or forehead. And then I also have a squirt bottle. So if she's sweating, I can squirt her. And just a good piece of advice for the squirt bottle is you can drop a few drops of aromatherapy in there, squirt the mom, but also squirt the room. And then lastly, I have an eye pillow. So if she's getting kind of stressed out and she's calmer, I can place the eye pillow over her eyes and be really relaxing. So that's a little peek into what I personally carry in my doula bag. So there's some tips for the partners, you know, like the toothbrush, the Advil, you know, extra hair elastics, and then there's some techniques to help with the pain management, the ball, the Rebozo, the hot water bottle, the fan, the washcloth. So I hope that gives you a little insight of not only how to prepare what to bring, but also some things, again, for mom and partner, and food. Don't forget food. That doesn't live in my bag all the time, but I do have that available for myself and the people around me. So for my pregnant mamas out there, I hope that you have a wonderful birth and that this is insightful, and happy birthing and happy night. Take care. Namaste.